Today we will be describing septal resection using bipolar resectoscope, using bipolar energy source. We are entering the cervical canal. We can see there are filmy additions in the cervical canal. Yes, there are filmy additions. This is resectoscope with 2.9 mm telescope, with 2.9 mm telescope. So we are entering the cervical canal. Yes, we are at the level, almost at the level of internal os. We are about to negotiate the internal loss. We are about to negotiate the internal loss. So the take-home message here is go gentle, avoid perforation. So we have to see where we are. Slowly. We are at the level of internal loss. We have almost negotiated internal loss. These are the filmy additions we'll be negotiating. So first we will clear the camera because we have sub-zero temperatures here in Srinagar. Today there is prediction for heavy snowfall, heavier to heavy snowfall in Srinagar on 2nd of March 2024. So 2nd of March 2024 there is prediction for heavy to heavier snowfall. We'll be doing this with bipolar. We'll slightly reduce the energy in the light source. So we'll be dealing one by one. This is the right ostia. Let us check where is the left ostia. Let us check the left ostia. So somewhere here is the left ostia. Somewhere. Yes, this is the left ostia subseptate cavity. On ultrasound, we have diagnosed it as septum of around 1.6 centimeter. Septum of around 1. With the grace of Almighty Allah, we should be able to do this nicely in less than 3 minutes. This procedure ideally should be done with minimal use of the distension media, Since we are using bipolar resectoscope, so fiber by fiber will be cutting. So again, we'll change the direction towards the other side. 3-4 ways of dealing with such cases is, one is important, we can use operative hysteroscope and do it with scissor or monopolar hook. Monopolar hook, the only disadvantage is one has to use the glycine. Since the operating channel for the operating channel for the operative hysteroscope is around 5 French only. So 1 French is equal to 1/3 of mm. 1/3 of millimeter is equal to 1 French. So disadvantage will be that only monopolar hook can be used, bipolar cannot be, because bipolar will need bigger operating channel. So the other modality of treating this with tissue resection device that has an operating channel of 9 French, with an operating channel of 9 French, should be able to deal with it very nicely. So this is the bleeder here, and third is using the monopolar or bipolar resectoscope. Using resectoscope is one of the important mechanisms of dealing with transcervical resection of myoma or septum. So this patient, primary recurrent pregnancy losses with 2 abortions. How many abortions? With 2 abortions. 1 missed abortion and one was a blighted ova. So the septate uteri, bicornate or subseptate uteri do lead to what? Recurrent pregnancy loss or subfertility. Recurrent pregnancy loss or subfertility. Slight pressure. I will request my assistant to increase the pressure. We are using the bipolar current. So as an energy source. So almost we have reached the end point on this side, and we'll try to reach the end point on the other side. Our theatre in charge, Harkar IVF Center, Mr. Niraj was very keen that we should be doing such procedures with bipolar or monopolar resectoscope. So only thing, one of the disadvantages of bipolar resectoscope or monopolar in general resectoscope is it needs dilatation of the os, internal os as well as external os. Once you are dilating internal or external os, what will happen? Such patients will need cerclage later on, because to prevent cervical incompetence. See, here we have reached the end point, and everything is intact. So this case we are dedicating to our esteemed seniors, particularly Satish Kumar Govind sir from Kerala, who had taught me hysteroscopy and laparoscopy. Dr. Satish Kumar Govind sir from Kerala, slight pressure. So we are changing the. So important here is to reduce the use of saline. Saline can be used up to 3 to 5 liters in single stick, whereas glycine should be reduced to less than 1 liter. Glycine should be reduced to less than 1 liter. We have reached end point here without any. Yes, and we have not compromised. Septum. We have not compromised any residual septum. So Mirasa will clear the vision because we are living in sub-zero. You can see we have done the job. Almost the job is done. We can see the bubbles.